What do you do if you had your mammogram and you get a letter from the breast center saying, come back, we need more testing? What happens next? Welcome back to my YouTube channel. I'm Nefertiti duPont. I'm a board-certified gynecologic oncologist, and while I do treat GYN cancers, I don't treat breast cancer, but I have a lot of patients that have breast cancer in my practice, and so I'm very familiar with breast cancer, and I also have several family members that have had breast cancer. So if you have had a mammogram and you went for your screening mammogram and you got a letter from the breast center saying, oh, you need more pictures, you know what happens next? I completely understand this because this happened to me on my very first mammogram. I got a letter saying my mammogram is abnormal. I needed more testing. And I was like, oh my gosh, what do I do? I have a family history. So of course I was very worried. I called one of my best friends who's a radiologist and reads mammograms all day long. I said, can you read my films? And while not everyone has access to radiologists in their family, I'm going to tell you some of the things that I did and some of the things that you can do to be prepared. The first thing is don't panic. The world just is not ending. A lot of times radiologists may need just additional pictures. Maybe the original mammogram you had wasn't as clear as they wanted it to be. Like in my case, I had only had one mammogram, so it's my very first one. So I didn't have any others to compare it to. And, I later learned that I have very dense breast tissue, and sometimes masses are missed when you have dense breast tissue. So what I did is I had initial screening mammogram. I had to go back for a diagnostic. So a diagnostic mammogram, they just take more pictures. And so when I have patients calling my office saying, or I'm calling them because their mammogram is abnormal, I need them to go back for additional testing, I'm telling them exactly what I went through, and what I'm telling you is that, it may not be cancer. It may just be that they need additional imaging because they couldn't see really well, or maybe you have some lumps that, wasn't there before, or if this is your first mammogram, they don't know if this is normal or if this is just something that's unique to your body. So first, don't panic. Second, show up for your appointment. So, make it as soon as possible. Don't wait a month. Don't wait 3 months. Go right away. As soon as you find out, call them when they're next available and be seen, and make sure you have the test done. A lot of times they may do an ultrasound and a diagnostic mammogram to make sure that everything's okay. And typically my experience has been is that the radiologist will come and talk with you after the exam while you're there and kind of tell you what they think and your findings. And for a lot of women, that really eases their mind. Sometimes, not always, but sometimes they'll say, we want you to come back in 6 months to make sure everything is stable. And so if that happens, it's not the end of the world. Just make sure you keep your appointment, because a lot of times they want to look at changes over time. So don't forget, if they say come back in 6 months, come back in 6 months. Don't come back in a year. I've had patients do that. Try to, come back in 6 months. If you've got to put a reminder on your cell phone or write it on your calendar, whatever it takes, make sure that you keep your follow-up. Because I have had patients over the years that were supposed to come back in 6 months and they got busy or they forgot, and then a year went by. Sometimes 2 years goes by. Don't do that. If they say come back in 6 months, come back and continue to do your self-breast exams, because if you feel something different or something has changed in that 6 months, let your doctor know or let your healthcare provider know. And then when you come back, a lot of times the radiologist will talk with you. They'll definitely send you a letter, and they'll send your doctor a letter about what follow-up needs to be done, whether you need a biopsy. And, my mom had one a couple years ago and I went with her. They are a little bit uncomfortable, but just keep in mind, if you have to have a biopsies because they want to get a tissue diagnosis, sometimes when you go, they'll put a little clip in the area of concern because they want to be able to monitor that area. So, as time goes on, they want to be able to follow that area to make sure nothing's changing. So again, if they call you back, it's not the end of the world, but definitely follow up. Okay, so if you have any questions or if you have any experiences that you want to share, put them in the comments below, and I'll see you next time. Thank you for watching.